Pediatric Dental Anesthesia Associates is a different kind of practice. It's a special kind of practice. Children who need dental treatment are often fearful of the dentist, and they're unable to cooperate for the dental treatment they need. It's our goal at PDAA to provide the absolute highest level of clinical care and customer service experience for our patients, their families, and the dentists. It's very exciting to be a part of a really innovative practice that's on the cutting edge of anesthesiology. PDAA has grown to include almost 50 pediatric anesthesiologists and almost 300 clinical support staff. We now serve over 600 offices of pediatric dentists, and we're continually growing, looking to expand into every state nationwide.
We have a tried and true method for sedation that has proven to be the highest safety rated method of sedation for over the past 20 years.
We are proud of our safety record as we have grown over the years and have cared for hundreds of thousands of patients without a serious complication. Our team of board-certified anesthesiologists includes several former department chairs, recognized national experts in patient safety, and the subspecialty of pediatric anesthesiology.
As pediatric anesthesiologists, we understand working in a hospital, and we know the importance of the care we're providing there. However, over time, we also understand the burnout that can develop. So it's a great opportunity to find a different way to practice. It can be challenging to take that leap of faith, to try something new and innovative, and to bring your skill set in a place that's in desperate need of it, which is the pediatric dental office.
Working in a hospital as an anesthesiologist, you're very often just a face in the crowd. Many people like to joke around that they don't remember their anesthesiologist at all. So I did not foresee at all coming to work with PDAA, actually being a face of a local chapter of a franchise.
In the hospital, we're faced with a lot of hospital politics, and it's refreshing to escape from that and realize that you can be even more successful without it all.
Working with kids is fun. They're able to laugh at themselves. You can't take yourself too seriously when you're working with kids. Being able to be silly, being able to be goofy is what keeps me feeling young and keeps work fresh. One of the more edifying parts of the job is the challenge of working with kids with special needs or particularly autism spectrum disorder. Many of them aren't able to lay compliant for dental work without us. So we've really been able to, as a practice and as a group, fine-tune our approach to where we hear time and time again how smooth and easy it was for some of these neurodivergent kids.
These dental offices are inviting us to come work with them for the day. They're trusting us with the sedation of their patients so that they can focus on their expertise. So it's quite a team and a partnership, unlike that in the hospital with the surgeon.
We jokingly call this the Disney World of nursing jobs because it really is like that. Not only do we get to provide safe and effective care, but we also get to provide a really fun and exciting environment and experience for the patients and their families. We work with pediatric anesthesiologists, and we also work closely with dentists and dental staff. I think it really makes a big difference for the patients when they come in and they see that their whole team of people who's going to be taking care of them gets along and loves their job and just wants the child to have a really great and fun and safe experience.
When I talk to other physicians with PDAA, they all tell me that one of the best parts of the job is the work-life balance that they're able to achieve.
An excellent thing about the schedule related to PDAA is that you can weigh in pretty significantly on what your availability will be. I truly enjoy what I do on a day-to-day basis, and then it's just kind of an added benefit that I know I'll be home for dinner at the end of the day to spend time with my own family and my own kids.
We have control over our schedule. It allows for me to be at most of my kids' events at school. That's a huge bonus for us, and these highly sought after holidays that we normally would never get off in the hospital. At PDAA, we get them off. If I want to go take a 2-week vacation to Europe, I make the adjustment and mark that off.
With PDAA, we get the opportunity to travel to new communities, to introduce a high level of safe care, quality anesthesia services to pediatric dentists in communities that may not have access to this level of care.
I know that my little patients are in great hands when PDAA is here. They're monitoring, making sure the child is doing well while asleep. The safety is excellent, and I can focus on providing the top quality dental work and focus on the procedures instead of stressing about the sedation.
So when you join PDAA as a new physician, you're going to go through an extensive training period. It's like a mini fellowship. And at that time, there will be an anesthesiologist with you that will be mentoring you and teaching you what are the intricacies of working in a pediatric dental office.
PDAA does an amazing job with educating, acclimating, and teaching you the PDAA way.
We are kind of the captain of the ship. We get to make the treatment plan and screen the patients, and then meet the patient beforehand, bring them to the operatory, induce them, start the IV, push our own medications.
It's very rewarding to have that ability and autonomy to have control over the efficiency of your day.
At PDAA, you will have the opportunity to personally impact the quality of the anesthesia care that your patients get. This is because you can spend time with them personally explaining the anesthetic, controlling the environment, controlling the nursing, controlling the amount of attention that you give, personalized attention to meet the needs of each one of your patients.
It's so gratifying to know that we can go out and make a meaningful connection with a child, their family, with the dental office, feel like we're providing a service that they just can't get anywhere else. One of the best testaments to the safety and quality of our practice is when one of our own nurses, dentists, or dental staff choose PDAA for their own child's sedation.
Not only am I a nurse, but I'm also the mother of a patient. I knew my child was going to be in amazing hands. The high level quality of care, the safety, the comfort they provide, the kindness they provide, getting down on the child's level, talking to them as if and treating them as if they were our own children going back there.
When my son needed a dental sedation, I went through all the emotions as well and wanted to make sure I was doing the very best thing for him. And we had the option to go to surgery center or do it in the office with PDAA. And I chose to go with PDAA after going through it and seeing how professional and how fun they made it for my son. I have no regrets. I'm very glad that I did it that way. That makes the experience, the best it can be.
If you are a physician committed to providing safe, high-quality pediatric anesthesia care, then I invite you to learn more about us by reaching out, and we look forward to discussing with you how you can become part of our unique team of physicians providing excellent anesthesia care for children.